So one of your physicians or nurse practitioners or physician assistants has noticed some abnormality on your blood work, and they said, well, now I want you to see a nephrologist. What is a nephrologist? We're individuals that are specialized, or we take special care of people that have kidney diseases or kidney trouble. We also deal with people that develop kidney stones, people that have had kidney transplants, and we are blood pressure specialists as well. So many times they tell you on the blood test they saw an elevated creatinine. What is creatinine? It's just a small amino acid that breaks away from protein. And so the more muscular we are, the higher degree of that protein or that amino acid we have. So the higher our creatinine is going to be. However, when we lose kidney function, creatinine is one of those molecules that stay in a person's bloodstream, and that's why it's elevated. And that's why we can record that and then make some extrapolations as to what your overall kidney function may be. So there's not just that blood test. There are several other blood tests that we look at and we interpret to see if there's a significant degree or problem with your kidneys and whether or not you need a kidney biopsy. Please don't get nervous or scared. Very few people need a kidney biopsy, but it's very unlikely that you're going to be one of them. However, if the labs or lab studies or the urinalysis suggests that you do have significant problems, then yes, we will proceed or arrange for a kidney biopsy. Typically, the intake or the discussion will take anywhere from 30 minutes to an hour. We'll have that discussion. You'll go through a cursory examination, and we'll talk about your medical problems that are present and bothering you and see if any of these problems are related to your kidney disease or potential kidney disease in any way. Maybe you were sent over to us because you have protein in the urine. You won't feel protein in the urine. Sometimes you might see bubbles in the urine. These bubbles, many of us have those bubbles in our urine to begin with, but those individuals that have multiple bubbles where it looks like the head of a beer, that could be an indication that there's significant protein in the urine. So we'll assess for that and we'll see how much is there. Each one of us should be are allowed to excrete less than 150 milligrams of protein in a day. Yours might be significantly higher. Don't be overly alarmed about it. We'll find out the reason for it. And as I stated a few minutes ago, we may need to pursue a kidney biopsy to find out if that's true, what the cause is, and if that's truly the case. We also take care of people that have difficult to control blood pressure. The majority of the departments that take care in the United States in the medical schools, it usually says the Department of Nephrology and Hypertension. So that's the majority of facilities in the United States. And so many of us are not even aware of that. We're trained specifically to treat or manage blood pressure problems. Although your primary care doctor, cardiologist, rheumatologist, endocrinologist, we're all trained as internists, and all of us have the basic knowledge to take care of hypertension, whether it be primary hypertension or secondary hypertension. It's the individuals that we take care of that the primary doctor or other physicians may be having a difficult time finding the right regimen. There may be something underlying that we'll come in and search for that and help make the necessary adjustments on your antihypertensive agents to get your blood pressure in a better control. Kidney stones. Sometimes a urologist will send you over to us, or maybe you'll self-refer because you're getting stones over and over and over again. We may ask you to do a 24-hour urine collection to help determine what is causing these kidney stones, and then we'll be able to make the necessary recommendations to help prevent them in the future. Transplant patients. This is probably one of the most rewarding scenarios in our lifetime. Kidney transplants have only been successful for less than a generation, and it's getting better and better as each day passes. There are multiple transplant centers around the country. We're utilizing not only deceased donor kidneys. We're asking people if they have significant kidney disease to discuss with their family members and look for a potential donor. We like to say you've been given 2 kidneys. You were born with 2 kidneys, one for yourself and one to give to a loved one should they need one when it's medically necessary. Finally, medications. Please bring in your medications. You can take a picture of those medication bottles or write them down, the doses, how much you take in a day, the exact name of the medication. That's extremely important. We need to know all the medications you're taking, whether they be over the counter or not. Please bring in a list of your medical problems. what they are. It doesn't matter what they are, how far remote in the past they were. Tell us about your family history too. If you're adopted and don't know that information, of course, share that with us as well. We want to know pretty much everything about you to try to piece together the story and help determine what's causing or contributing to your kidney problem, so we can make the visits as painless as possible. Let us know about the surgeries that you've had. There have been patients that have come in and forgotten to tell us that they had cardiac bypass surgery, or they may forget to tell us they have a pacemaker. Please, anything that you've had done, whether it be a hip replacement, joint replacement, any work on your teeth, etc., don't hesitate to tell us. We need that information. Okay? Thank you so much for listening, and have a wonderful day.